So welcome to KDH Collective's Leaning into Therapy. It is a podcast that is done by licensed therapists. So I always interview a licensed therapist and we talk about mental health issues. Today, we are going to talk about a class that we are doing on neurodiversity, neurodivergence. So I am KD Holmes. I have 16 years in private practice. And today with me, I have Whitney Storey. And
Hi.
Whitney, tell us about yourself.
I am a licensed professional counselor here in Louisiana with KDH Counseling and Consulting and Collective. And I specialize in criminal justice counseling, neurodivergence, and perinatal mental health. And so it gets real good when I get to integrate all of those pieces together with neurodivergent birthing people in jail.
Wow. Yeah, that's
Yep.
a whole thing. Well, and I think, the reason I am so passionate about neurodivergence, I see it in all my clients. It's not just like, I think there are a lot of therapists who think it doesn't pertain to me. I don't see people on the autism spectrum. But since I have started diving into this like framework for looking at the clients that I treat, it's everyone.
Yeah, I think the same thing. I think because counselors, therapists, because they don't like market themselves as neurodivergence, neurodiversity affirming, or as neurodivergent people, maybe they think that neurodivergent clients aren't coming to them, which is super problematic. So, I mean, for lots of reasons, which I think we're going to talk about. So,
Yes. So why don't we talk about, let's start with why it's important. Why is it important to get trained in this? Why do we think it's so important?
well, and I think when I was thinking about this, I feel like you and I can share how it's shown up in our therapy sessions. And I think also talking about it from the standpoint of, being a mom, being somebody who teaches students, working with people in the jail, and just how it's showing up everywhere. So, I mean, one thing I was thinking is, of course, me, I love data. I was reading through some literature, and the best estimate that, at least the published literature that we have, says that there are probably about 20% of people who are neurodivergent in some way. And my guess would be that's probably higher because we're missing people for sure.
Well, and that's what I'm thinking, because I heard the same thing with this friend
Yeah.
of mine, Erica. But it seems like 20% would be low. And is it possible that is just what we're seeing in our office? Is that 20%? That seems skewed.
Yeah, especially if the research, I'd like to go in. I think it was a meta-analysis that gave us that percent, but I'd like to go in and see how they found 20%. Because if they're going off of the DSM, like we know, the DSM criteria for autism is leaving out women, and people of color and people who are LGBTQ and all of this stuff. So that's a lot of people that it's leaving out. So
Well, and if it's only a diagnosis, who are the people who aren't in therapy, who haven't been on any mental health services?
yep.
There's that part of the population, right? And then the way that we see it.
Well, and we've had conversations about this too, in kind of like the beginning of you and I talking about it. It also makes me wonder, like, what boundaries are they putting around the idea of neurodivergence? Because we've talked about, like, is OCD a neurodivergence, or is that something different? And I mean, the literature is the same way. Do we count traumatic brain injury as a neurodivergence? I don't know what the answer is, but 20% is at least a number to start with, I guess.
Definitely. And if it's 20%, most of those people are going to be having mental health issues because of the nature of it.
Oh, yeah.
So, I mean, I guess a brief explanation. Neurodiversity is the differences neurologically across the whole human species. I mean,
Yep.
that's broad.
Yes.
Neurodivergence is
So neurodivergence, it would be like the particular category that somebody might fall into, meaning that their brain works in not in a neurotypical way, which is, again, it's kind of hard to describe a concept with like the word in the definition. But yeah, generally, I mean, depending on what you're looking at, So we could look at it through the lens of anxiety. People who would like meet criteria, struggle with anxiety, their brains diverge from the norm in terms of like fight and flight kind of responses. Yeah.
Which is everyone, because
Yeah.
especially in trauma, right? So a lot of people with anxiety disorders have a trauma history. And if it's developmental trauma, it probably affected the development of their brain.
Oh, for sure.
They would fall into that neurodivergent from the norm, kind of, I guess, like category.
Mm-hmm.
Then OCD. OCD is biological. Brains are different. That would
Yep.
fall into it. ADHD,
Yep.
myself, right? That would fall
Autism.
into it. Yes,
Yep.
autism. And then we're not even talking about like some of the people I see don't have a diagnosis,
Oh, yeah.
but fall under these, right? I even have like some ADHD clients who are not diagnosed because it's not interfering in their life, but I can see where their executive functioning is being affected in how they relate to people and in different areas in their life, right? And their impulse control, things like that. Which I think looking at it through this biological,
Mm-hmm.
like biologically, what is happening in their brain? Is this a part of what their symptomology is? So is what I'm seeing in my office due to something in their brain and a difference? If so, it's neurodivergence. That's is that how you understand it?
Yeah, and I think that's where like we get into some really important stuff as therapists, where if this is an inherent, biologically driven difference in brain function, then there's nothing that we can do in terms of like talk therapy or even like strictly behavioral stuff with like ERP or something like that to like change the way that the brain is functioning. And I think that really highlights, so for example, with the amount of women, adult women who are coming in without a diagnosis and describe the way that they've been struggling their whole life. Sometimes they get other diagnoses and they get treatment that's appropriate for these other diagnoses, which then further exacerbates the issues that they're having. And I think especially when we're thinking about, working with people who are maybe already coming from a standpoint of less ability in terms of like financial means, the means to take off of work, the means to like have a babysitter to seek treatment. A lot of people who are like chronically mentally ill and have been being treated for a long time, it makes me wonder if it's a neurodivergence, we're making it worse.
Well, and think, so what are some of the diagnoses that when it's in our office, we're like, wait, is this autism? Is this something else? Okay. Borderline personality disorder.
With women, you're looking at borderline personality disorder, narcissistic personality disorder, histrionic personality disorder. Those are kind of the big ones. And then generalized anxiety disorder, which is I'm technically diagnosed with, like, but it's not that. And taking my Zoloft, which I love, is not going to change the natural way that my brain processes information.
Correct. And I think, so I also look at social anxiety. Anyone that comes in social anxiety, I'm like,
yeah.
And if they're an introvert, like those two things, I'm like, let's see, is this autism? I mean, it's not necessarily the case, but it can be. PTSD. People that have a trauma history and they have PTSD symptoms, but their trauma isn't like, it's milder forms of trauma, but yet it affects them in the super intense traumatic way. I'm like, autism, is this? Because people on the spectrum and ADHD have sensitive nervous systems.
Yes.
And right. And so trauma is more traumatizing to their body, I think it is, than other populations. So I agree. The personality disorders personally is like the most fascinating, I think, for me, or the most helpful. When I have someone with a long history of these things, ODD, oppositional defiant disorder.
Oh, yes.
And I start, and I start looking at it through this framework, it blows my mind.
And it's interesting, I think, too, thinking about this, because I feel like the way that we try and approach these diagnoses, we would use the same words to say it. Like, we're treating this like personalities are something that never goes away. there's also like with neurodivergence, this isn't going to go away, but everything that comes next is totally different. Because with those personality disorders, there's so much stigma. It's harder to find care. There's so much stigma just in your personal life. Like getting that diagnosis is like inherently stigmatizing, even just if you know about what people say about these diagnoses and having it be, a personality disorder or something like that. But when you get a diagnosis of like autism, ADHD, sensory processing disorder, something like that, there's more help. There's less stigma.
There's less stigma. I have a friend that specializes in borderline, and I love her. So she's very competent. She's like, it's completely treatable. It's resolvable.
Yes.
So she personally has no judgments about it, but in the world, there's so many, right? And it's sad. There's something wrong with our mental health system, but I do think that some of the protocols out there are very helpful, but they are not, in my opinion, standalone. So when I have my most severe cases that would typically fall under borderline or something more intense, when I look at it through the neurodivergent piece, it allows for more solutions because of the occupational therapy part and some of the awareness of sensory differences. It allows for more treatment that's more effective. I'm not saying the therapy piece is wrong, but I think it needs to be both. It's like, and you're not going to change the way your brain functions. And expecting it to function like everybody else sets you up for failure in therapy. Like I start even think about outcomes in therapy if you just use traditional models.
Yeah. And I was thinking while you were talking about that, like one of my favorite, like basic counselor stuff with Carl Rogers, like that unconditional positive regard, like the flavor of unconditional positive regard that you get through this lens feels more true to unconditional positive regard as opposed to unconditional positive regard that you might have thinking about and working with personality disorders. Because it almost feels like the stigma around personality disorders is like, I'm going to love you in spite of. Whereas with this, it's like, I'm going to love you because your brain is different and that's cool. And we need different brains, which is just so much more healing.
Well, and in my observation in here, there's so much genius in these populations. And I talk about this. I know when people are struggling with something, it's hard for them to see anything good in what they struggle with. But it is so common in here that I'm like, oh, that's genius. That's genius. And they're like, well, I have all this shame about it. And I'm like, okay, I'll try to keep this to myself. But that is genius, the way your brain works and picks apart information, the way you come to solutions. Yeah, it's more of an acceptance of who you naturally are.
Mm-hmm.
And it's not, I want to be clear, it's not allowance. Like if someone, okay, hyperactive, myself, right? Hyperactive. Say my issue would be, for instance, because of my ADHD, I get angry and I fly off the handle and scream at people. As a therapist, I would never be like, yes, go ahead and keep doing that because you have ADHD. I would still be like, you have ADHD. So your impulse control is probably not 100%, and that's okay. But we need to account for that. And like, let's make some buffers for it so we can address that issue. I think as therapists, we're either like we get black and white, total allowance, or that's how they think, and no change, or we're pushing them towards change. But sometimes it's a little bit of both.
Yeah.
I hope that makes sense.
I mean, it makes sense to me.
Yeah, I just feel like the biological acceptance piece, man, it has blown my mind as a therapist. Since I started working this way, I've had better outcomes with people who typically have long histories of not getting better with other therapists. I do so much trauma work on the cultural piece of judgment about their difference. I mean, so much now when someone comes in my office and they're like, I'm different, and they have a story of like, why am I so different? I'm like, they're neurodivergent.
Yes.
Where is this, right? Because it's such this innate, even from really well-meaning parents, but this innate misattunement that happened like so early on that they just couldn't accept that they were different because we are different.
Yes. Yeah. I think this is such a a good way of also talking about the not just neurodivergence making trauma feel more trauma-y, but also that being neurodivergent is inherently traumatic. Like getting messages growing up your whole life that somehow the way that you are is some kind of like moral failing, or behavioral failing, and you're bad, and why can't you get it together, and like you try and connect with people but they don't connect back. It's yeah, it's traumatic.
It's so painful. Like, even as you say it, I'm like, it's myself as one of these people, right? It's such a painful experience, and feeling like you just can't get it right. And there's no script to tell you how to do it
Yeah.
exactly right because of something biologically that's going on inside of you.
Yeah, there's some, I was trying to think where I even read this. I don't even know where. It may have been in Unmasking Autism, Devin Price. It may have been in there, but looking at a lot of autistic people talk about even like getting the script right, like doing the thing that people do. But there's something innately in our brains that it still isn't right. Like people still look at us doing the thing, but it's still off.
Well, because I think it's not authentic. So even though we can do the task, like in here, I can be a therapist that's not hyperactive. It's exhausting at the end of the
Yes.
freaking. People can do the task needed, but because it's not a natural state of how they function, it requires so much more energy, and it's not as rewarding because it's not authentic. I don't think those same pings happen in our brain when we are authentic and somebody sees us
Mhm.
and we connect in that very authentic way. That's an interesting topic.
Mhm.
I could talk about that a lot because there is something in that you don't get when you're just pretending.
Yeah. And I think that's another thing. I mean, for me personally, and I don't think I mean, I know I'm weird, but I don't think I'm weird when just this one thing, like even like living from a very authentic place like all the time, people don't trust that either. So it's such a lose situation for neurodivergent a lot of the times, because I mean we get messages about like, no, you got to like do it right, and we do it right and that doesn't work. And then we get messages of like, well, that's because you're faking, you need to just be you, and then we be us, and that doesn't work. Yeah, and so it can get really lonely, and it makes total sense to me why people would kind of like shut down, kind of close, make their lives a little bit smaller, not take those risks, because you're damned if you do and you're damned if you don't. So
Well, in that not authentic place, man, it's tough. I think, yeah, we get the message that we should be authentic, but people don't really want us to be authentic. Like, it
yeah,
makes me sad to say that, but that is the
yeah,
reality of the world. They don't want to hear the things that I'm into. They don't want to hear all the crazy, like, I will read some crazy stuff and I want to talk about it. People don't want to know about this stuff. And that
no,
can be not having that experience of someone being excited about what I'm excited about. Those again, subtle misattunements, but it does create a message in my world that being me is wrong. And I mean, we haven't even talked. So we're just talking about like the general neurodivergence world. We haven't even talked about when it comes with LGBTQIA,
oh yeah,
when it comes with Black or Brown, like any sort of cultural difference, what it starts to look like even then. Because if that's 20%, then you're looking at even a different part of that population and more hurdles to overcome to build
for
connection.
sure. There's less safety. I really, I mean, I can't speak for the, the queer community, but from what I've heard, like this innate, like probably earlier than just neurodivergence, figuring out that they're different. I mean, I've heard people talk about like from literally like preschool age, knowing that they were different somehow. And I feel like most people kind of like figure out neurodivergence a little bit later than that. So it's like earlier feelings of lack of safety and not fitting in, and like the fear that comes along with realizing that at a really, really young age and having to hide. for so much more of like a realistic safety reason, I think, than the reason that like neurodivergent people get the desire to hide. I don't think it feels as like life and death, as truly life and death, I think, as for a lot of people describe when it comes to like sexuality and gender and stuff like that. And like race, that's exactly race and ethnicity, like the legitimate life and death, as compared to brain feeling life and death. That's really intense.
Well, yeah. And so I'm thinking, okay, not race aside, if we just looked at LGBTQIA and we think about it in terms of someone being raised in a religious environment, autism, gay, knowing early on, I mean, when your brain's still super black and white as a small child, that if I let this be known, I will be cast out. I mean, that is what it feels like. That is the experience. So you get it in your home and then you get it in your community. I mean, that can be a lot for any human. And we're not even going into the gender thing, right? If they feel they are different, if they know they're a different gender, right? And they're having to navigate that in these systems. Okay. Then black and brown. So race, you're neurodivergent, you're different.
Mm-hmm.
You're in a world that has so much racial like crime. I'm trying to figure out how to say it, but just like abuse against you because of your race.
Mm-hmm.
I mean, there's just like this double layer of like, I have to get it right. That sense of urgency that you're talking about, that if I don't, something really bad could happen.
Yes.
And even the way we talk about it, like if somebody's ODD and they're black or brown, I bet it's viewed different or
Oh
talked
yeah.
about
Oh yeah.
than
Yeah.
if they're white and ODD. And these are all things, we're not even talking about the socioeconomic piece, right? Because you can be quirky as all get out, right? And be in a private school and have any of these differences, like a really small private school, if your family has money, and you won't really notice it.
Yeah, it's definitely a safer environment in some ways.
Yes, so it just depends. Yes.
Yeah.
I'm just like, I think that there's so many factors that play into this that to be a competent therapist, competent, I'm going to say it,
Mm-hmm.
need to know about neurodivergence because it is in our office more than we're aware of. It is affecting how we're doing therapy. And if you're not aware of these differences, you are misattuning, misaligning, maybe having neurotypical expectations on your clients
For
and
sure.
setting them up for failure. I mean, even down to like my neurodivergent clients sometimes can't do meditation.
Oh yeah.
Like, close your eyes. They're like, that's insane. That seems like a small expectation that if we keep trying that's how we do it here. We do mindfulness. I love mindfulness, but I'm just
Yes.
saying it's not appropriate. And the way that we do it for the masses needs to be tweaked.
Yeah. And I mean, there's a lot of research and lived experience coming out about how CBT is ineffective for autistic people, uh,
Why?
and
Go
potentially harmful. So, I mean, personally, CBT did not work for me. So, I mean, I guess I'll start with like the personal side of it and then talk a little bit about the research. It's kind of the same. It's nice when research like confirms personal experience. But I mean, a big thing with CBT is that basically our cognitions are where we're getting it wrong, basically, that like thoughts lead to feelings, lead to behavior. And so if we can change the thoughts, then we can change the feelings and the behavior naturally. For a lot of people, a CBT is great. The research, I mean, of course, we all know everybody gets taught CBT, everybody hears about CBT, everybody at least practices from a standpoint at some point from CBT because it's the dominant evidence-based therapy. However, there is also some research showing that for a lot of people, when it's helpful in the short term, in the long term, it's actually not helpful. So we see like the effectiveness kind of fall off. And the reason I think for this is that for a lot of autistic people, our cognitions are not coming from like illogical thought. Like our cognitions are not illogical. Like we are seeing people reject us, and we are seeing like when I talk to people about things I'm really excited about, I can see that little flicker of like, somebody wanting me to stop talking. I'm not making it up. Like I see it, it's evidence. And so when a counselor says to me like, "Oh, people love you," like I'm sure, like, is it possible that that flicker is about something else? Well, like, yeah, but it's not. And so CBT just wasn't effective.
Well, and for me, I think it was a lot of wrestling my thoughts. You said that one time we
Yes.
were talking, and it's true. I would write it out. I was like a star pupil,
Oh,
star
yeah, yeah, yeah.
therapy pupil, like, what do I have to do? You want me to do it every day?
Okay.
Do it, do it.
Affirmations, got it.
But it did not change
No.
what was going on in my body. I mean, trauma work has. I will say trauma work has been the magic for me.
And that makes sense because it's less about like telling us that our thoughts are wrong. It's about telling us that our brain and our body are kind of like responding in a way that they don't need to. So that makes more sense to me that like, yes, you saw something, there is something there, but also you're okay. It hurts, but you're okay. Because brains don't like that. Hurt equals pain equals death for brains. And so I think that's part of that makes sense to me from like a health standpoint, as opposed to like, well, just stop thinking about it.
Well, and my
Okay.
brain stopped thinking, ha ha
Oh,
ha.
okay.
Even after all the trauma work, so my brain used to be repetitive and anxious. Now it's not anxious, but it's repetitive. I can say some bad words. It is. I will think
And I,
something a
yeah,
thousand times. Like that is just how it
talk
goes.
about this all the time with clients and with my students too. It's like my brain comes up with the wackiest stuff. And that it doesn't mean anything. Like I was after I dropped my kid off at school this morning, driving under a bridge where the train was just sitting there. It wasn't moving, and my brain said, "The train's gonna break the bridge, and it's all gonna come crashing down on you." And I was like, "That's terrible." But thanks to like therapy that's been helpful for me, I don't have to like grab onto that thought and let it like pull me around the rest of my day. Like I can go like, "Oh, that's a weird thought."
Well, and let's look at this through. So traditional forms of therapy would say that's an anxious thought, right? But in the neurodivergent world, how would you look at it? I can say my 2 cents, but what would you do differently?
A couple of different options. One option is like, okay, that's a thought. Like your brain has tons of thoughts. Thoughts are just like weather. It comes, it goes. Like, I wish this weather would go. PS. It would be nice if it would be a little cooler. But also I can't do anything about it. So why would I sit there and spend energy and time trying to fight with the weather when it's just something that comes and goes? So
And
that's one way. And then
cognitively
also,
challenge it. Like
yeah.
that's a waste of time, right? Yeah.
So,
Okay.
the other way I could look at it is like my brain is so good at watching for potential danger, and like thank goodness I would not like to get crushed by a train. Thanks brain for looking out for me. That's really nice.
So yours is like an act perspective. So
Yes.
I would do, and where I've been going lately is like, do you have a sensory visual sensitivity? So I'm like, you just see everything in the environment, and danger is one of the things, but you'll notice everything. Whereas other brains might see two things, and not that they're not as smart as us, but maybe they're not. And you see all of it. And
Yeah.
so you can't get rid of that. This is how I kind of introduce the neurodivergence thing. You will never stop your brain from doing that thing. We
And
have
man, think about like back in caveman days, think about how helpful that caveman was who could like take in everything. Like that's such a strength. And
yes.
we are not cavemen, and it would be probably really nice not to have to use so much energy to see everything all the time.
I do. And sometimes I'll do education. Like, are there times where this is helpful? And they'll say things like, when I'm studying for a test
Oh yeah.
or something when I'm
Like
decorating my house.
bringing
Yeah.
the kids to the park and not having to like be so like follow them around to keep track of them, like just to be able to like sit and be and know exactly where they are. That would be great.
Yes. I'm really stuck on the benefits of it lately because I feel like when we accept that there is some benefit to it, it's easier than to accept the thoughts, the act stuff. When it happens, right? We can just accept like this is just what our brain does. You're not going to change it. People spend so much time in therapy trying to fight it, get rid of it. I don't want to have this anymore. This is so disturbing. Like I still have repetitive thoughts. I
Yeah.
just anxious. And I just let it happen. Yeah. Is it annoying sometimes? Yeah. But I don't really fight with that. I'm just like, my brain's doing what it does. And so I think that the neurodivergent lens allows for more acceptance and allowance, and it's more empowering.
Mm-hmm. Yeah.
We're going to do more on these, but what are your closing thoughts on neurodivergence? Why do you think it's so important?
I don't know if it's anything new, but I really think it's important to just like reiterate the fact that as a clinician, I have seen a lack of understanding on this topic harm people. And as a human being, I have seen a lack of this harm me, and harm my kid. And so I just think it's so important for therapists to it's like the most basic therapist rule. Like our whole job is to like not harm people. Like that's like rule number one. And you can't you can't do that to the best of your ability if you are coming from a neurotypical only understanding.
Agreed. Agreed. I mean, because of the pathologizing and not seeing the whole picture.
Mm-hmm.
You know, if you just see it as generalized anxiety disorder and you're not taking into account how autism or ADHD or whatever else could be,
Sensory stuff. Whew. Yes.
yeah, you're doing a disservice to your clients. Man, I'm that opinionated about it.
Mm-hmm.
I am. And I hate even saying that, but I feel like in our world of therapy, there is very little understanding and of this, like informing how we do therapy. And if I get a report from a psychologist, it always has this stuff in it, which I'm like, okay, this is interesting. So they see it. They're noting all these like things that are going on, and
Mm-hmm.
they're making a prognosis based on that. Whereas we as therapists will make a prognosis in our mind, but we look at it differently.
Yes.
And it's weird. I'm like, how do you combine those two? Not that I think psychologists are smarter than us, but I do think that they are looking at things in a certain way that could benefit us. I'm not saying either or. I'm like both
Yeah.
and, right?
Yeah. I mean, the more that you know about somebody, the more that you know about somebody.
Yeah. And the more we can empower our clients.
Yep.
Where I'm like, yeah, how do we empower them to know about themselves forever? And in reasonable, like, I guess, reasonable evidence-based ways. This stuff has been around since 94, I think.
Oh yeah, yeah.
Conversation. So we will have more. Join us for our class. We'll send a link if you want. It's Neurodivergence for Therapists, LPCs, LCSWs. We have continuing education hours for LPCs, and we're applying for the LCSWs. So we'll have more on this.
Yeah.